All right, and welcome back. I'm so glad to have Beth Dyson here from the White Mountain Community Health Center. Good morning.
Good morning. How are you?
I'm doing well. What is your role at the White Mountain?
So I'm what's known as a health insurance navigator, which
We
sounds
need
like, what's a navigator?
Well, I'm telling you, we need it. So
a navigator is somebody who helps people through the marketplace. So very often people get their insurance through their job, or if they are very low income, they can get state funded Medicaid through New Hampshire Easy and the New Hampshire Family Plan. But there's a lot of people, like myself, who work but don't have insurance offered through their job. So we have to go on the marketplace. That's the Affordable Care Act, commonly known as Obamacare.
Okay. And
So I help people navigate that. Yes, we have had some changes.
That's why I'm especially glad that you're here today, because we're going to need some navigation. And it's a shorter period of navigation, too, which is one of the hot points.
That's one of the hot points, yes. Last year it was till January 31st. This year it's only till December 15th. So November 1st to December 15th, that's only 6 weeks.
So tell me the rules and regulations. Everyone has to be covered nowadays?
Like
or you get penalized, or what happens?
You do get penalized if you don't have health insurance.
How do you get penalized?
Well, at the end of the year, you have to, when you file your taxes, there's a tax form that you have to fill out saying either you had health insurance, or if your company will send you a letter saying you had qualified health insurance, and you have to file that with your tax forms. If not, they figure out a percentage. So generally the amount is around $695 for a year for somebody who's not covered. And it goes according to each month. It can be 1/12 of, depending on if somebody who lost their job in the middle of the year, had a health insurance, and then didn't pick up another job that had the health insurance, they might have 3 or 4 months without health insurance.
But there are some caveats to the enrollment period. And I know, if you have a change of marital status, that kind of supersedes this enrollment period.
So
correct?
the enrollment period is the general enrollment period, and then after that, if you've had a life change, so if there's been a death in the family, if you've had a baby, if you got married, if somebody attained immigration status, those all kick in, or you lost your insurance, or you had been on Medicaid, and because your income level, you got a new job, your income level went up, then you got denied Medicaid. Those are all events called special enrollment period events, so your eligibility makes it so that you can apply during other times of the year.
Okay, I got you. So let me just clarify one point, though. If you had insurance in your job and you lost your job, does that qualify? Is that one of the... Okay, good, because some people are like, it's not my fault that I missed the enrollment period.
Exactly. So that kicks a special enrollment period. I still work with people up until a couple of weeks ago who had lost their job, who just wanted to get some insurance until the end of the year. They didn't want to be uncovered, so I was able to pick a plan for them.
Excellent. All right, so let's talk some other details. We're talking about the levels, the 250% of poverty.
Right. So the way the system works is that you have different levels: bronze category, silver, and gold. Platinum is really expensive. Generally, the premiums are higher. The better the metal level, the higher you go with your premiums. If you are in between up to 250% of the poverty level, and the poverty level for one person is around $16,000 this year.
So that is 250% of that is $40,000 per year, per person.
You can get help not only with your premiums in the form of a tax credit, which you can apply right away to lower your premium. So, for example, if your premium was supposed to be $500, you could get a really nice tax credit of maybe $300. It's all, they base it all on math.
And does that happen automatically, or do you have to apply for that?
No, it happens automatically. When you put in the application, you fill out the information on your income for 2018, and it'll pop up, you're eligible for tax credits of XYZ amount, and then you can see what the premium would have been and then what you would pay each month.
Okay.
And then up to the 250%, you can also get some cost savings reductions for lower co-pays and lower deductibles.
So that's poverty to 250%?
Yes.
Okay, so there's help. I was just going to say, what about below 250% of poverty? Because there's a lot of people there.
Yes.
And then over that, you're on your own.
Well, from 250 to 400, you still get the tax credit.
So all the way up to 400%.
Right.
Okay.
You just don't get the extra.
Excellent. All right. So we have the shorter enrollment period, November 1st through the 15th.
Yep.
There's certain things that you do qualify for help if you need it. how can people get help with all these?
Yes, it can be very overwhelming for folks, and even people who are comfortable on the computer can think, okay, there's too many choices. So they can call the health center, 447-8900, and ask the front desk to make an appointment for me. I'm generally I work under a grant, so technically I'm only supposed to work 3 days a week, but during an open enrollment, our supervisor said, look, work whatever you need to work, and we'll make up the time later. So I'm actually going to be working 5 days a week.
Oh, my goodness, yeah.
And then I'll have walk-in. If they can't, a lot of people work. Yeah. So I will have some dates both at the Conway Library and at the Tamworth Library, where I'll be working there from like 1 o'clock in the afternoon through 7 o'clock in the evening.
Wow. So my big question is, can we clone you? Because
yeah, I'm the only one for Carroll County.
Person. Oh,
I'm the only one for Carroll County.
Really?
Yes. There's only one Navigator.
Absurd. Wow. Is there a cost for the service?
It's absolutely free. I work under a grant.
I'm like,
there's no reason not to call. The one thing I would say is that if you have Minuteman health insurance, they're no longer going to be offering health insurance in New Hampshire. So you should have received a letter saying you have to pick a new plan. Very often what happens is if you have, let's say, Ambetter or Anthem, you might get a letter from them saying, oh, well, we're going to just auto-enroll you. Our plans have changed a little bit. We'll auto-enroll you for next year. But it's always important to check to make sure that your doctors are covered, your prescriptions are covered.
So things could change. They're like, oh, you're coming back with us, but I've changed the complete plan.
Yes. So it's important for people to check their plan and to actually either go online to healthcare.gov, update their application.
Healthcare.gov?
Yes.
Writing it down.
Yes, it has to be healthcare.gov. If you just Google healthcare, there will be a lot of different ones that'll come up. But healthcare.gov is the official federal site that actually has the...
There's probably a lot of parties trying to siphon you away from the actual site.
Yes. All right. And then if they don't know their login information, you need to have your username and password. I have a phone number. They can call 800 318-2596, and that will get them to healthcare.gov, and they can say, look, I forgot my login information, my user or password, and they get it reset so that it makes the process easier when we go online.
Because what I'm thinking is we should have an event calendar event, like a billboard with that number, especially as we come up to the enrollment period.
That'd be great.
Here,
Thank you.
Right quick, so people have that as a resource here. Do we hit all the points, Beth, that you wanted to?
I think we did.
Gosh, I don't want to let you go. I want to schedule an appointment right now because I know I have to review. So it's quite a resource. And tell me just a little bit about the White Mountain Community Health Center.
So White Mountain Community Health Center is a small community health center. We offer services for families, adults, midwife. We have midwife. We do prenatal. We have social workers. We have a teen clinic that is offered. If folks, for some reason, don't have Medicaid and they can't afford the Affordable Care Act, which there's some people in the Valley that work
Insurance is expensive.
It's expensive. We actually do a sliding scale fee based on income. So always, don't let your health care go away. It's important. It really is. It's coming up to the shopping season for the holidays, and a friend of mine said, put that at the top of your shopping list because your health matters.
It does. And, people like to... Insurance is not a fun topic.
It's not a fun topic.
It's one of those necessary evils, though, and it covers you in case of catastrophic stuff.
Well,
it also helps you maintain, teeth, eyes, whatever you have going on, especially for the babies.
Especially for the babies. And there are a lot of preventative services that come with your health insurance that you don't have to pay for. A wellness exam every year. As you get older, mammograms for women, colonoscopies for adults. Those are all free of charge if you have your health insurance. If you don't have health insurance and you need something goes wrong, I broke my wrist a couple of years ago, and I had to have minor surgery on it. It was not even there for a day, and the bill was $30,000. If I hadn't had health insurance,
about to pass out.
Right. Wow. If I hadn't had health insurance, just one slip, I fell and
it happens.
Crashed It happens.
I just had my mom just broke her forearm. It's crazy.
So it might seem like it's high, but
no,
it's all it takes is one.
Because you don't want to be sick and then have those financial strains on top of that. So it's one of those things. Do some research. There's help out there. Beth is there for you
happy
too.
To help.
and
I
she
do
can help you
Medicaid
navigate.
applications also.
All right, good.
So if
don't
somebody
let
has
that.
an issue, yep.
Yeah, if you don't have a computer, head on
Yep.
down, and she'll be at various places. How do we find out where you're going to be when?
You go on our website or our Facebook page, whitemountainhealth.org.
Okay.
There should be a list there of where I'm going to be.
Okay.
I'll have 2 evenings at Conway Library and 3 times down in Tamworth Library at the Cook Memorial. Yep.
Spread the wealth. Awesome.
Spread the wealth and get the help.
There you go. She just came up with a new tagline. Beth, thank you so much. It was nice to meet you, and I really appreciate what you're doing for our community.
Thanks so much for having me on. It was
All
a
right.
pleasure.
White Mountain Community Health Center. They're located right as you're traveling south on 16. They're on the right-hand side. How would you describe your location in case folks
Well, if you know
need to get
Jonathan's
to you?
Seafood cuts off there, there's a red building that's been renovated. We're right past that on the right-hand side.
Yeah, and right before the plaza.
Right before the
It's
plaza.
an independent building there,
It is.
so
it's
it's
a
right
yellow,
on the right.
kind of a yellowish
And you have
building.
pumpkin people out there, right? I think they do.
We might, yeah.
I think you do. So you stop on by, check it out. They're going to be doing helping folks with the open enrollment coming up starting November 1st. Do they have to wait till November 1st?
That you cannot actually pick a plan until November 1st.
Goodness, all right. So November 1st
Yeah.
through December 15th, shorter window.
Yes.
And Beth's going to be on hand to help you navigate all of those plans. So we'll be back. We have more Watch and Win to do. Another look at the weather. It looks like it's going to get a little rainy.
Yeah.
And then we'll also be looking at event calendars. So don't go away. Thanks again, Beth.
Thank you.